Hi everyone, Dr. Patel here with Hillside Medical Group. Let's talk about testosterone deficiency. It's so important to talk about this because many folks are diagnosed with this, especially men, and they come seeking for help at our practice. So let's go through this diagnosis. I think it's very important. So when we're diagnosed as clinicians, testosterone deficiency, we're looking for lab finding, especially testosterone level less than 200 at two different independent lab draws. Not one, twice. It's important to get two separate readings, and it's also important to get testosterone level checked at least before 10 a.m. Normally, we like to get it done at 5 o'clock in the morning because that's when the testosterone level is at its peak. However, of course, there are no labs open, so then the recommendation is to get a lab draw done before 10 a.m. because after that, it takes a big dive. Besides that, with the two independent reading, it's important because when you are on testosterone replacement, it increases your risk of cardiac disease. Increases your risk of strokes. So it's important to have an accurate diagnosis. Once the diagnosis is established, your provider will start you on testosterone therapy to get the levels between 200 and 800. Now, we have some individuals come asking for the levels more than 800 because they feel that they perform better at a higher level. Absolutely not. The goal of testosterone replacement by your provider and physicians is to make sure all your organs are working well, all your hormones are working well, not to make sure that they help you bulk up. So, again, the goal would be to get it between that 800 and 200 to optimize the functioning. Wonderful. Testosterone should be checked on a monthly basis until we make sure that the dosing is confirmed to where we want it between the 200 and 800. And of course, it's a controlled substance. So please note that many providers would do frequent drug screening to make sure that patients are not also abusing other recreational drugs with it. Um, that kind of summarizes it. Again, going back to it, testosterone deficiency, lab two independent draws to have testosterone level less than 200. Draw needs to be done before 10 a.m. Your provider will start on therapy, frequently monitor testosterone level until we reach that constant state of having testosterone level between the range of 200 and 800. And once that is established, then potentially they'll transition you to every 3-month follow-up, though the drug screening is also frequently requested to make sure that there is no other recreational drugs being used. I hope this is helpful, and of course, our all of our locations can help with the treatment of this. So if we can be of any help to you, let us know.